This is huge. The huge is, God damn it, this Brian is only 26 years old. He published research article in the ankle orthodontic. Do you know how important is that? When Brian showed me this copy that he just published in ankle orthodontic, I was very surprised. Very surprised. Because all the ankle members, there are very, very few members in the world. And their life goal is to publish their research in the ankle orthodontic. And you are not ankle member, and you got published. I have never seen that before. Consider your age. Never. Oh, by the way, this is my family tree. I learned orthodontic from Dr. Robert, and Dr. Robert learned orthodontic from 1, 2, 3, 4. These 4 doctors. And the major mentor is Charlie Burstone. So Charlie Burstone accepted Gene Robert as a graduate student in Indiana University, 1969. He told Dr. Robert, you got to accept. You become my graduate student. But let me tell you, I'm quit here. I'm going to Connecticut. So next year, you go to Connecticut as my first orthodontic student. That's why Gene Robert was the first graduate student of Dr. Burstone in Connecticut. That's the story. So he got accepted in Indiana, but he attended Connecticut. When Dr. Robert became the chairman of orthodontic in Indiana, he wanted to set up a special program called PhD Ortho Combined Program. And the first student for this program happened to be Chris Chang, and I was the first PhD. And the first orthodontic PhD in the United States his name is Chris Chang. Before Chris Chang is master program. Orthodontic is master program, not PhD program. I was the first one. So he trained 11 PhD orthodontic there and 150 master clinicians there from 1988. That's my family tree. Just that you know, you learn orthodontic from me, you know the family tree. So I'm going to show you randomly several cases how Beethoven treat class 3. Because I was inspired by Brian. When Brian showed me this article, I was so surprised about the way he can interpret cephalometric analysis. So I just put them together to show you how Beethoven fixed the class 3. And we focus, because the mechanic, you already know how we design the mechanic. I want to show you how we interpret, justify the mechanic. So the way we did it, by far, is cephalometric. You cannot use common CT. And you cannot just use model or just use the intraoral. Did you see? It is almost impossible to bring the incisor back and keep the same inclination. Let's show you how difficult this case was. The molar drift forward because the patient missed the low first molar. So I was close the first molar space. So I uprighted second molar, bring the second molar forward, close this space. Not only bring the molar forward, I also retract the incisor backward. And that's how I correct this class 3. The way I did it, I use class 3 elastic, bi-turbo, and Damon. I don't use mini screw in this case. Why? Because the patient lost the low third molar. That's the result for this class 3. And close the low molar space. And look at the CIII, she only lost 23. In 2013, McNamara, chairman of Michigan, he publicly announced there are 3 real experts in class 3. The number 1 is Peter Nan. Peter Nan is Chinese from Hong Kong. The second one is his student, Lorenzo Facci. Lorenzo Facci invited me to give a lecture. It's here. The third one is Chris Chang. When John Lin told me this, I told Dr. John Lin that was wrong. It's not Christian. John Lin. It was a mistake. The name. That's my response. Because I didn't attend the lecture. The reason why I know is because John Lin told me, do you know, McNamara just announced 3 real experts in class 3 is Christian. I said, no, it's not Christian. It's John Lin. Do you understand? That's how I control the damage between John Lin and Chris Chang. I'm very proud I say that to John Lin. That was a mistake. It's John Lin. It's not Chris Chang. Immediately. Number 2. Can you believe it? Oh, this case, Christine already presented earlier. 31 months, camouflage treatment. Low 7 degree. Why this case low 7 degree? Because we take out first premolar. If I can treat this case again, I will take out second premolar. So I probably would not lose this 7 degree. And besides, the second premolar, the root is short. But unfortunately, the first premolar occlusal table is not flat. The occlusal table, the occlusal table of second premolar is much better than first premolar. That's why we take out first premolar. And we pay the price that we lost 7 degrees. Did you find it is very difficult to make decision which treatment you want to go for? There is no ideal treatment plan. Every treatment has a weakness, has the strength. This is a huge. How could that possible? This case can be fixed without orthodontic surgery. In this case, we lost 15. The reason why we lost 15 is because we take out low premolar. Number 2, because this is the huge retraction. Number 3, because this case, we use Damon Q. We don't have Optima at that time. Optima and Damon Q are different. The slot is different. The wire is different. That's why these 2 different protect the top. Huge. So the solution, extract further back, which is second molar, or Optima. Huge. Don't you think? That's why in those cases, I always say Damon Q Optima, because these 3 years, we are thinking about to focus on what's the difference between Damon Q and Optima. After these 3 years, when we figure out, we would not mention about Damon Q of them because that's company's product. We don't want to mention that. So, wow. This girl, her mom was so famous in Hsinchu, very famous. And they want a non-surgical approach. Did you see how severe? And at the end, we be able to solve the problem like this. Do you know how much we dislike the low molar? How many millimeter? Right? Yeah, 3 to 4. And we solve the problem. huge change. Don't you think? We have never seen in the orthodontic history that people present a case like this without surgery. But the last one, Brian's case. Brian is already published, already finished published. Did you send to the AJODO? Okay, tomorrow, send to AJODO. I want the AJODO to know that there is the way to control the low talk with optimal bracket and Y. This is very, very good case. We talk about this case many, many times. We did not lose the talk control and we gain 4 degrees. Can you imagine? Because the slot and the wire. So this is huge. The huge is, God damn it, this Brian is only 26 years old. He published research article in the angle orthodontic. Do you know how important is that? With the help of big brother, Dr. Alex Lin, so Lee and Chang Lin. So big congratulations for you both to publish this one. Dr. Lee asked me why I allow him to become the first author. 2 reasons. The number 1 reason is this is your study. You decided, you deserve it. Number 2, this is not invited publication. Some article is invited. They invited me, so I have to be the first author. Other than that, I will. You just become the first author. Okay. So look at the cephalometrics. So I would like to ask you, our mentor. Mentorship is important. I keep this mentor, Dr. Rob, and we've been together for 35 years. Can you imagine? Brian, let me ask you, what's the most important tool to conduct this study, medical tool, beside the computer? How can you conduct this study? What kind of documentation? No. The study. You are using what? Cephalometric or what? Of course. Dr. Tui. So let me go back to Dr. Tui. This is back to 1960. Dr. Tui become the most famous doctor in the world. So every doctor want to rush into the Tui Foundation to learn from Dr. Tui personally. So many. And in the old day, when the people go to Dr. Tui, they were dressed like this, very formal. If you dress like that, Dr. Tui will not see you. Very formal. And those people are very famous and rich. In 1989, at the age, this is my professor, Jim Vaden, Dr. Chris Chang was just 27 years old. I went to this one. Is that amazing? 37 years ago, that was Chris Chang. And I got inspired. This trip was the most important trip in my life. It totally changed my mind. I decided I want to go to United States to get a good education. I already received orthodontic education in Taiwan. So I spent the next 2 days, I explained to my instructor how I decide, after the 3 course, I decide I want to study in Indiana, and that changed my life. And that might change orthodontic history. When he heard about my story, he was crying. Can you see he was crying? He has never seen any story like this. And he make a conclusion. Christian is the most famous orthodontic in the world. He said that in public. You recorded that. So next time, pray that again. So what I'm going to tell you is a very, very interesting story about in Dr. Tui's office. He has this first cephalometric machine. And this machine, let me show you one more. This machine is right here. Why this machine is so important? Because the people who invented this machine decide to send the first machine to CIII, because CIII was the most famous at that time. And CIII take this machine and invent the whole cephalometric analysis. And the one who invented is Hwai-Nan. Hwai-Nan invented this one when he was only 37 years old. And he gave it to CIII. CIII was 36. And CIII get this gift and invent the whole cephalometric. That's why you have the chance to do this study with this cephalometric. So, conclusion. You needed to know orthodontic was start with here. And we have Brody and CIII as the first generation, go to the third generation, fourth generation, and fifth generation. And finally, you have this one. Take a photo so you know your root. Next time, when people mention Alan Brody, you know who is Alan Brody, who is CIII, who is Charlie Burstone. Okay, with that, thank you. Happy New Year.